All right, so lights and sirens. It's important to kind of do a risk-benefit analysis here. When do we use lights and sirens? Well, generally speaking, we have to use them going to calls, but not always. And then going to the hospital, you have to really consider the status of the patient and the intervention. So what does the patient really need? You know, heart attack patients who have a known heart attack who are going to the hospital, you know, they need to get there. Their definitive care is at the hospital, and there is a good chance that they won't survive without that. So you can certainly consider it. But here's the thing. Research shows that lights and sirens have a very limited time savings. The exception to this is if you're going through an area with a lot of red lights, so like maybe a downtown type area, or you're in heavy traffic where you can actually get around. So if there's a shoulder that's open that you can take, you can put your lights and sirens on and take that. But in general driving, the average time savings was only around 20 to 30 seconds. So it doesn't really get you there much faster. It's not safer. It's much more dangerous. Most of the wrecks that we see occur when lights and sirens driving is going on. So you have to really consider, is it going to benefit my patient? Do I really need to put the lights and sirens on? All right, so the warning lights. These are the flashy lights. They're usually red and blue, or just red or whatever color they are. You use those at all times when responding to emergency calls. Another thing to consider is put your headlights on during daylight hours. It lets drivers know that you are there, especially if you're in like going under an overpass or other area that's kind of darker. If you're in heavy fog, and when you're parked, you want to use minimal lighting. The emergency lights are very distracting to drivers and can actually cause people to run into the ambulance if you've got the ambulance parked somewhere with all the lights on. So it may be that you turn off the emergency lights and just kind of put on the flashers if you're parked in a place that's safe. The siren. How many of you guys have been driving in your car and all of a sudden you hear this siren and this ambulance that blows by out of nowhere? Well, here's the thing. The sirens have been on the whole time, but unfortunately they're relatively ineffective. The sirens are just difficult to hear. Cars are sealed up really well these days, so they're hard to hear. Never pull directly behind a car and blast your siren. That's not okay. Sirens can affect patients adversely, so it can make them more anxious and more agitated. It makes it really hard to hear in the back. And the sirens can cause the driver to speed or take risks that are not appropriate because it just gets you really kind of amped up. The adrenaline gets going and you don't necessarily make the best decisions. Here's the thing. When you're driving the ambulance, you have to give other drivers time to notice and react to your warning devices. You know, put yourself in their position. A lot of them haven't really been very well educated on what to do, which, by the way, you're supposed to pull to the right or just make a hole. Make a hole for the ambulance to get through. But a lot of people don't know that. A lot of people just slam on their brakes and stop, and they just don't know what to do. So don't be mad at them because that'll just make your day go bad. Just give them enough time to notice and react to the warning devices. All right, so some driving tips. Safety. This is obviously number one. The most common reason that EMS personnel die in the line of duty is because of ambulance accidents. So everybody should be seated and secured, all personnel, even in the back. If you're in the back with a patient and you're not actively involved in patient care, you're still supposed to have your seatbelt on. Riders, of course, if you're bringing any family members with you or friends, they need to be secured. And the driver. This is the driver, I believe, according to state law, does need to be buckled in. The passenger, I guess, should as well. The laws have changed in the recent past to require that passengers are required to wear seatbelts. And then in the back, again, if you're not actively involved in patient care, just put your seatbelt on. The patients, of course, need to be secured on the cot with all straps tight. There are a lot of distractions for drivers. If you guys are working as a team and you're the one driving, get your partner to give you directions. Don't be looking at the GPS. Try not to be talking on the radio. At some point, though, there's a good chance you're going to be driving, maybe emergently to the hospital, and somebody's going to try and contact you on the radio. Do your best to stay focused on the road. Other distractions, your mobile computer that's going to give you your call information. Again, the GPS and getting directions, using the radio, operating the visual and audible devices. So one of the things that you have to learn to do is driving with the sirens. That's something that the driver operates. So you kind of have to learn to switch them. Some of them have foot pedals, some of them are buttons. It depends on the truck that you're in. The vehicle stereo. Don't use this if you're going to a call emergently. If your partner wants to put it on, that's okay, but be sure you know where you're going and you know how to get there. Wireless devices like cell phones, don't use them. Don't use them while you're driving. And then eating and drinking. It's not uncommon for us to go and try and get a meal, and then immediately, as soon as we get our food, we get a call. And you're hungry, you haven't eaten all day, but it's really a bad idea to be eating while you're driving. Good driving basics, make sure you're mentally fit. If you're upset about something or you're stressed and you can't focus on driving, then don't drive. Go home, use a sick day. Make sure that you're able to perform under stress. This is a stressful job. There are people who are going to drive in front of you and it'll make you crazy. You kind of got to drive like everybody's out there to kill you or to get in your way. You have to have a positive attitude about your own driving abilities, and you need to be tolerant of other drivers. I think the last one is sometimes really difficult, especially where you have a day that it seems like everybody's trying to cut off the ambulance. But you have to be tolerant of other drivers. When you're driving the ambulance, you need to practice and you need to get familiar with the acceleration, the deceleration, the braking. How does it corner? And what's your fender and bumper clearance? And not just fender and bumper, but also how tall are you? What can you fit under and what can't you? Driving emergently, you should be keeping to the left. Other traffic ideally should be to the right, but that's not always the case. So find the safest pathway to travel and never ever rely on what another motorist should do, because they don't ever follow the rules.